In the back of my mind, it haunts me that it's not going to work, and I want it to so bad that I'm afraid I'm setting myself up for heartache.
With the holidays right around the corner, lots of people are getting ready for family get-togethers, but there are still lots of couples out there who don't feel like their family's complete yet. According to the Mayo Clinic, 10 to 15% of couples struggle with infertility, but it's something we don't talk about a lot, and there's no one solution. The fertility specialist we spoke with actually said he thinks the problem is getting worse because more people are obese, waiting until they're older to have kids, and in Missouri specifically, he often sees issues in men, more so than the national average. So over the next few days, we'll explore this issue through the stories of mid-Missouri couples facing it head-on.
I mean, having her call me mommy, it never gets old.
There was a time when Kristina Shannon worried she may never have the chance to spend her morning playing make-believe because she has polycystic ovarian syndrome.
Something else? Just frustrating because we did want it so bad and having to wait all that time and not knowing, can I even get pregnant?
Finally, she and her husband went to a fertility specialist, and after only one round of artificial insemination, little Harley was on her way.
The job is basically very simple. You need to get a good egg with some good sperm in a good uterus. That's our goal. Unfortunately, the devil is in the details.
Dr. Gil Wilshire says people often don't see fertility specialists because they assume they cannot afford it. But a procedure like Shannon's costs about $500.
I love you. Oh, I don't know how we lived before we had her. She's our everything.
Nick and Sarah Andres, on the other hand, have had a much more difficult journey with infertility.
Wanting something so bad, and you don't want to put the blame on each other, but most of it, if you want to, it's my fault that, this isn't working out as far as my body goes. And so I hated myself because I couldn't make him a dad.
They went through several rounds of fertility drugs, artificial inseminations, and 2 miscarriages, something Wilshire says is more common than he'd like. Almost a third of his patients' pregnancies do miscarry. It's been an expensive process. The Andres have already spent about $25,000 on fertility treatments before they decided to try in vitro fertilization, a procedure that they estimate will cost them another $12,000, and that's all out of pocket. 15 states mandate some sort of insurance coverage for fertility treatments, but Missouri is not one of them.
I don't get paid a whole lot, Sarah don't get paid a whole lot, but we just did it as we could. We're in debt. But yeah, we did it, so so far so good, and we should be able to do the IVFs.
So it's easy to understand why on the morning of Sarah's egg retrieval, they're both a little nervous.
Medication.
Nick waits outside while the anesthesiologist puts Sarah to sleep and Wilshire gets to work.
The needle goes in the follicle. The follicle will collapse now under the vacuum pressure from my foot pedal, and there it goes. You can send.
After less than an hour, the doctor removes 32 follicles.
A spectacular result.
16 eggs fertilized, but because of complications, they decide to implant only 1 and freeze several others to potentially use in the future. After the procedure, Sarah learns her ovaries became overstimulated. One more problem she did not expect.
They were touching, so every time I moved, it was excruciating pain. I couldn't sleep. I couldn't lay down. I didn't work for 2 weeks. I couldn't do anything. It was just terrible, terrible.
Terrible, but worth it, she says, to see this.
We're just looking for a little black circle in the uterus today.
She found out the IVF worked on October 1st, and she took a pregnancy test every day for the first few weeks, just to be sure.
He thinks I'm crazy, but it's like I have to. It's a mind thing. I don't know whether to cry or to get excited or to still be nervous because now I got to wait 2 more weeks, so that's a lot of pregnancy tests.
Most doctors recommend seeking the help of a fertility specialist if a couple's been trying for a year without conceiving, or 6 months if the woman is 35 or older. A few things you can do to help your chances of conceiving: get your weight under control and cut out any risky behaviors like drugs, alcohol, or tobacco use. Coming up tonight on KOMU 8 News at 10, we'll take a closer look at the emotional side of infertility and a local resource to help women struggling with it.